It is January 8th, 2021. I want to welcome you into Coronavirus Inside the Arizona Numbers, where we take a closer look at the numbers and the news coming out of Arizona as it pertains to coronavirus. I'm Katie Rammel. Alongside me here, Garrett Archer, helping us to analyze all of these numbers as they come in. Garrett, we were just posting just a few minutes ago here online about new White House task force saying that they're concerned about this massive spread, asking if this could possibly be our own mutation, if we actually have a U.S. variant that's happening here. We'll talk more about that throughout the hour, but we start where we always do with the numbers coming out of the state of Arizona. Some very high numbers reported in again today.
Yes, let me go to the azdhs dashboard where we always start. So this is what we're looking at today: 11,658 cases and 197 deaths. Now, sadly, because of what we've seen in the last several weeks, none of these are peak numbers any longer. Yesterday's number, I know we weren't on yesterday, but we almost posted 300 deaths yesterday. And so what we're looking at here is for our cases. This is the fourth highest cases that Arizona's reported. It's the second highest the third highest number of deaths and the second highest number of tests. So we're still at peak in all of these numbers here. You see 27,000 tests, 197 deaths, as I said, 11,658 cases. It said right now, as I said, Katie, with all of our hospitalizations and these case numbers we're looking at, it's just simply that the most colloquial way I could put it really is that, every day is the worst day for Arizona at this very moment. So we're definitely at a peak right now, and for the foreseeable future, we're going to be at a peak.
Yeah, so many people talking about how we had discovered that we were worst in the world. What has it been? Almost a week now since those numbers came out, and we've been sustaining that throughout this time. It's a tragic situation as people try to get back to their normal lives, but we're not anywhere near that at this point. When we look at this overall map for the state of Arizona, I know that we haven't been here each day with everybody because of all of the breaking news across the country and taking time for that as well. But what are some of the key numbers that stood out to you in the last couple of days from this page?
We're seeing, I'm going to move off this page just a second but it's related to this page. So I'm going to go to the case numbers right now and just go down here and show you what's going on in some of the different counties. So you can see if you focus on this part of the curve, because this is the most important part. This is Arizona, but you can see, like, for example, when I go to Maricopa County, you can see that Maricopa, obviously being the largest county, also follows what goes on in Arizona. And we're at a situation in Maricopa County where we are still at peak and continuing to go at peak right now. Mojave County is in the same situation. Mojave, very high numbers right here. You go to the Navajo Nation counties, Apache and Navajo, you see it's a slightly different situation there. You can see that their numbers are actually going slightly down as we're looking at these numbers. We look at Pima. You can see a climb in Pima, Yuma, but Yuma, for an example, looks like it may have already peaked. We're going to have to watch that to see what's happening, but it looks like right now that they've already taken a peak. And then Santa Cruz also in the same situation where they look like they may already be peaking. I'm going to put these at weekly data so that we can see it a little easier. You can see that there's been a pretty sustained decline in that county. In Yuba County, you can see a fairly good decline for the past several days or several weeks. Pinal County is not. It's definitely in a peak right now. Cochise County looks like there's been a decline. Apache County looks like it's pretty much an even rate, but we may have already reached peak in that county as well. So some of the counties, Coconino looks like it's still peaking. Some of the counties are doing a little different than others, but it does look like sort of everything's being driven by Maricopa County at this point.
Sure does. You know what? We're getting so many questions about vaccination. So I want to just quickly highlight that because I'm seeing so many of the comments and the questions about that. Obviously, it's our point of hope in all of this, our point of trying to get back to some sort of normalcy in life. Now, we've had the vaccine here in Arizona since December 17th. There's been frustration with the rollout process that it hasn't gone fast enough. For perspective, 21 million doses have been distributed across the United States. Only 6 million are in the arms of Americans already. So this is not just an issue that's happening here in Arizona, but in other places as well. President-elect Joe Biden saying he would like to open it up to all doses to have them just given out. At this point, people are saying, wait, we want to make sure that second dose is already in line, that it's there for people. And others are saying, just get it out as fast as you can. That 50% protection is better than nothing at this point. So we'll see what happens with that. But Garrett, I know you have some more things that are coming out from the state. Break it down county by county. We have counties moving into Group 1B already. So 1A is this first initial group of healthcare workers. That does not mean every single healthcare worker has been vaccinated. They're just opening it up to the next group to start getting people moving through. Those counties in Group 1B are Apache, Gila, Mojave, and Pinal County, already moving into 1B. Now, Maricopa, not far behind. Monday is the date that Maricopa will move into 1B. That chart kind of helps to show everybody.
Yes, it does. And unfortunately, I am having I'm having a browser issue, so it looks like I'm going to have to log off and log back on because all my browsers are not responding. For some reason, I can still talk to you, but I can't do anything. So if you could just give me about 30 seconds, I'm going to log off and come back on, and I'll have that vaccine sheet up in just a second.
No worries. And as you do that, I'll let everybody know sort of where we are. We'll see in a second, Garrett. Statewide, we've had 126,000 vaccinations given out. We had updated the numbers yesterday. There was a bit of fluctuation as they worked to duplicate some of those numbers. For perspective, in Maricopa County, 74,000 doses have been given out already. Only about 1,000 people in Maricopa County and 2,000 people statewide have gotten their complete series of vaccinations. So that means they get their first dose, they come back in anywhere between 21 and 28 days later, depending on what Moderna or Pfizer that they got. They come back, they get their second shot, and then that would be a complete series. So we've only accomplished that for about 2,000 Arizonans at this point. But once again, Maricopa County, they have submitted or administered about 74,000 doses, only about 1,000 complete vaccinations done in Maricopa County. Some hopeful news in all of this, and this is something that I tweeted about this morning and put out on my Facebook page. If you want a little more information on what I put out there, just hop on over to my Facebook page too. It's facebook.com/news from Katie. It's got the details on State Farm Stadium. That's going to be opening up for you next week, so you can start signing up if you're in phase 1A or in phase 1B. It's going to be a 24-hour site that they try to push people through fast enough to be able to get them vaccinated. This is not unlike what we've seen across the country. Places are asking their teams and their stadiums to open up their facilities or open up their parking lots to be able to do this. This is a testing site that we saw throughout the year as well. So they're modifying that just a bit to make it a vaccination site. But State Farm Stadium, again, opening up 24/7. Everybody's saying, how are they able to do this? This is actually coming from a grant that came in to be able to make this happen. So a massive undertaking, and hopefully it'll help to move those numbers just a bit. Garrett, looks like you're back with us.
Yes, I am, and I have the sheet ready to go. So this is what we're looking at as you talked about the different phases on where each we'll focus, of course, on Maricopa County, which will be moving to phase 1B on Monday. You can see 75,000, about 75,000 vaccines have been administered in the county so far, 126,000 total. As you said, Katie, as I came back on, you said that there was obviously a duplication issue yesterday. We are seeing a significant increase in numbers from yesterday to today, 113,000 yesterday to 126,000 today. And so that's an additional, what, 10,000 or so that they're doing?
Yeah, about 13,000.
Yeah, so that have been added today. So there is some ramp up going on. Obviously, and we talk about some of these counties that have gone into 1B. And as obviously as 1B is a larger population, they're actually accelerating the number of vaccines that we're seeing as well. For example, if I go to Gila County, you can see that the Gila County with the 25. Hold on, let me just make sure I'm in the right place. The 1420. Sorry, the 1420 vaccinations. Only 3 days or 4 days ago, that county was at 500. So they've essentially tripled over 4 days as they've moved into 1B. So we're seeing a lot of these 1B counties are starting to really ramp up, and that's what we would expect from Maricopa County and that the State Farm Stadium area. As soon as they get that pod open and they're going into 1B, the number of vaccines that are administered in the county, theoretically, should really increase and accelerate at a much faster pace. If they don't, that's a major problem.
Yeah.
And we should just be seeing this because a larger portion of the population is obviously eligible to get this vaccine at that point.
Yeah, a huge portion actually. So let's talk about who's in these two groups. Phase 1A is our healthcare workers, our healthcare support occupations, emergency medical services workers, anybody in a long-term care facility. That includes both staff and residents. When you move into 1B, it opens it up so much more here in Arizona. Education and childcare workers, we've got the protective services occupations. It's anybody who's 75 and older.
That's
Yeah.
a
And then
population.
a huge percentage of the population. And then I was looking closer at this essential services group and these critical industry workers. They've got a whole section, if you think that you fall within that, to go apply to be in group 1B. It's on the ADHS site, and you can find that there right there on the front page. They've got the link to go fill out that chart. This is anybody in critical industry. So critical industry, remember, is anything like transportation. If you own an auto shop, things that are keeping our whole infrastructure going. So it's a huge number of people in group 1B, but you do have to fill that out, and that does have to go through your employer. So you can't just be someone who worked in the field and is not anymore. It's got to be somebody who's working in those industries right now. That also includes any adults with high risk conditions and who are in like congregate care settings, and then of course, as we talked about earlier, anybody that's remaining holdovers from group 1A. So you could.
I'm looking at the census estimates right here, and just in that population category, there's about 800,000 Arizonans. So more than 10, about 20% or so of Arizonans, 10 to 20% of Arizonans will be eligible for the vaccine once, especially when Maricopa County goes into 1B. So we are definitely going to have a much larger population pool.
Yeah, so we could be hanging out in this group for a while, and depending on how well these 24-hour sites work out and how fast they get this thing going, we'll be watching these numbers for you and keeping you all updated on that. Just because people are interested, I'll highlight these other phases and groups really quick. When we move on to 1C, that's adults 65 and older, or adults of any age with any high-risk medical conditions. That's also adults who are living in congregate care settings and congregate settings, and then any remaining 1A and 1B. So once again, when your first group is done, it doesn't mean it's complete, and you can still go with group 1C, even though you're in 1A, for example. Then phase 2 is any additional high risk or critical populations. That would be the general public, and also any remaining phase 1 populations that have held over, just like I talked about. And then phase 3, the last phase, is just wide open to anybody. This is anybody who wants to get vaccinated. That's the final group. So that's kind of how it breaks down. If you want a little closer look at all of that, you can find it on the Arizona Department of Health's website. But once again, State Farm Stadium opening Monday afternoon is when they expect that site to open up. And this is going to be law enforcement moving through, again, all the other protective service workers, and you do have to make an appointment. Those appointments you're going to have to make online on the AZDHS site or through your employer. So a couple different options there. It's going to be very busy. There's still going to be a lot of people heading through there, but that's where we are through all this. Okay, so a bit of hope with the vaccinations, but we do want to move on to some of the other numbers here in the state of Arizona. We got a broad overview from you, Garrett. We also want to look, though, at our hospitalization numbers and talk about this White House task force information that came out this afternoon. So either of those that you want to move to next.
We'll start with the hospitalizations because we're already on the AZDHS data, so we might as well just finish up everything here. So when we talk about the ICU numbers, we're going to start with the ICU. This is the whole hospital census. We've been in sort of a similar holding pattern for several since the beginning of January, really, where we have the majority of our ICU is taken up by COVID-19 patients. About 63% of the census is COVID-19. About 30% is non-COVID-19 patients, and we have about 7%. And if you look at this number, they've tried to keep the hospitals have tried to keep around that 93%. They're trying to keep a 7%, 8%, 9% headroom in our ICUs, as opposed to, like, we've seen news reports of, like, say, Los Angeles County, where their ICU capacity is now at 150%. So they're desperately trying, at least statewide, to keep this number. at less than
And,
100%.
and Garrett, what is that exact number that was on there? I know last night we were reporting at that point, last night as of 10 p.m., it was about 129 ICU beds left open in the state of Arizona.
131 was
31. Okay.
today's report, 131. So
Yeah.
they're keeping it as level as they can. Inpatient beds, about 620 are left over. We are at a record number for those again today, 57% COVID-19 patients. About 3,000, 36% are non-COVID-19 patients. When we look at the emergency room department, there was a big drop off yesterday. I kind of attribute that probably to a reporting error with one of the hospital systems. And they reported again today, it looks like, because it went from 47 to 54%. And this is, as you can see, it's kind of stayed around this for all of December, going up ever so slightly, but they've, these hospital beds, and I think we attributed that to, when I've talked to some emergency room department physicians, this number going up is simply, it's almost like a queue for people who are supposed to be getting into the inpatient, getting into the hospital. They're staying in the emergency room department longer, and so the beds are being taken up because this is simply a bed count at 5 p.m. And obviously, as everyone knows, because I'm sure most of us have gone to the emergency room department, most people don't stay there for that long.
Right.
And they're not taking up a bed, but because of the number of ICU and inpatient beds that are taken up right now in the state, this number is going up slightly faster than it was, as you can see back here. When we look at the ventilator use, we are at, again, a near record today. Yesterday was actually slightly higher for ventilators, but about 60% of the ventilators in Arizona are being taken up right now. And then we'll look at the COVID-19 specific for ventilators. I believe we are at a record for that today. We are 799 ventilators for COVID-19 specific. ICU beds, we already talked that being a record. Our discharge number is a record today, a slight record. It's 941 to 940, so actually slightly below yesterday's. Emergency room department, as you can see, the numbers are still continuing to climb. This one you have to look more at the trend line rather than the actual date. And then the intubations, I believe, were a record today. So the record number of intubations in ICU today.
Yeah, it's incredible to look at these. And one thing of note, when we see ventilators, we have not at any point really in Arizona been at a shortage of those. We've always been able to have enough, at least in that category, where we saw other parts of the country that were working very hard to make sure that they had people covered in all of this. We have not had that problem. Wendy writes, my good friend died Sunday from COVID, 33 years old. It's heartbreaking. Wendy, it sure is. And this is why we talk about this all the time and try to help people better understand these numbers, because I mean, as much as we try to make sense of this, it's still in some ways like that. Makes no sense how you see how the virus reacts in different people and in different bodies. There's still so much to study in all of this, and I don't want to miss saying that we're so sorry for your loss, and thank you for taking time with us on here today. I want to get to some more of the questions. Julia's asking, so what is the required age for the vaccinations? At this point, it is approved for 18 and up and 16 and up. So two different, I believe, I don't want to say it wrong, but one is only 16 and over. Do you remember which is which, Moderna or Pfizer?
Pfizer is 18.
18.
And the other one is 16.
Yeah. So in most of those cases, that won't apply to these groups because most of these groups are already beyond 18 and in the workforce or in the 75 plus category. But that's the age group for approval at this point.
And we did talk to a medical doctor yesterday in our town hall, and he explained to us that the reason that they're not approved for 18 under the 18 right now is that simply they didn't do it. They didn't. When they were doing the mRNA, they did not do a study for the 18 and under. There was no one in the study groups that were those ages, so they could not approve the vaccine for those age groups. So they are currently working on even using the Pfizer and the other vaccines to get them approved for younger age groups, but they have to go through the normal
proper channels.
Yeah,
and I believe they were looking at 12 and up at this point,
yes.
So they'll work their way down in the age groups
Exactly.
as we go through that. Okay, so that's sort of where we stand on the hospitalizations. I do want to touch on a bit more, Garrett, what you were talking about. You guys did that town hall yesterday, and for anybody that missed it, can you provide more insight into what they were saying? I mean, these are people right in our hospitals that are seeing firsthand. What more did they share with you?
Well, Dr. Carroll did talk about so he gave some anecdotal stories about what was going on in the hospitals as he was, he gave us a story, very, very tragic story about two hospital patients that were sharing the same room. And unfortunately, one of them was dying from COVID. In fact, they had to resuscitate them. And the other person was also in the hospital room and having to watch what was going on with this other COVID-19 patient, carrying the same disease, and what sort of mental issue, what that does to your mental state.
Right, your psyche. Yeah.
And he said that the problem is that this is what they have to do in the hospitals, is because they are so full. They have to double up on these patients, and it's causing these sort of issues, and there are these other issues that can come from that, that come from having to be in just having
to have everybody
yeah
in one room.
Exactly. And then, we did talk about sort of what other things could be done. We just talked about with the under the 18 and what needs to be done at the school levels, and how we need to get the body of educators vaccinated as soon as possible, so that we can start making a strategy to get the schools back open.
Yeah, I saw some questions. Go ahead. Sorry.
No, please continue.
I just saw some questions in the comments about schools, and I want to remind you, you can find our schools section of abc15.com. It's abc15.com/schools. It'll give you a list of who's open and who's closed. I would say a vast majority of schools right now here in Maricopa County are closed down, at least until about the 19th. There are a handful that are open or opening up again on the 19th, but a lot of people just delayed that restart after Christmas break. And Garrett, the other question I'm seeing so often posed in the comments is this is this a holiday issue, or is this a snowbird issue? Is there even any way to tell the difference? I mean,
there's very little way to tell if this is a snowbird issue, if that's one of the reasons why we're seeing an increase. Now, I would say just because we're seeing these increases across the country, that while the snowbird issue could be a contributing factor to Arizona, specifically seeing higher numbers, and especially as we talked about, our case growth is the highest in the country and in the world. So that could be a definitely contributing factor. But the reality of the situation is, since all the other states are also seeing increases based on the holiday time frame we're looking at, that is having the larger impact on our numbers. And then the snowbirds could be adding to that. But really, it's the holiday travel that we're seeing right now.
Yeah.
And the other thing is, and we talked about this yesterday, is that, because, a lot of people, I know we see this in the comments all the time, people talking about the case-demic, and we're always talking about cases. And yes, there are a lot of cases that are asymptomatic or mild, but as these case numbers increase, a portion of those will always go to the hospital. 7 to 10% of those are going to the hospital.
Yeah.
And the problem is, the last time we had peaks in our hospitalizations and deaths, they came after. And this is in the summer, when we were having peaks in death and hospitalizations. They came after the case growth had started to go down.
Mm-hmm.
Our problem right now is that we're not seeing the case growth go down, which means we will continue to see an increase in hospitalizations as well as death.
Weeks.
The case growth have to go down first before the hospitalizations can go down, before the deaths can go down. And that's our biggest problem right now.
Yeah. As I always say, sort of three waves that we're watching for, and we're not even through the first one yet.
No.
On that note, you touched on schools, and I do want to remind everybody of the breaking news that came out just about an hour or two ago at about 1:30 this afternoon, or 1 o'clock this afternoon. The Arizona Interscholastic Association Executive Board had voted to cancel high school winter sports. And if you'll remember, they kept sort of postponing it, and we postponed right into the peak of things. So now they have voted in a 5-4 vote to cancel high school winter sports because of this surge in statewide cases that we're seeing. So I know there's a lot of disappointed kids out there, but I also know that there's a lot of people who appreciate this sacrifice by these athletes to work to keep everybody safe. So
and really, if the government does if we're able to get the vaccines distributed and get onto phase 3 by sort of April-May timeframe, then with this, hopefully we won't be seeing any of these in the future, because the hospitalizations will be down to what they typically should be at any any given month, we'll start being able to handle this thing at a
Yeah.
much better level.
Yeah, Monica's weighing in. She says, I just picked up my 94-year-old mother-in-law post hip surgery at Chandler Regional, triage tents all over and helicopter landing. Yeah, that's what we've seen out there too. In fact, we were flying Air 15. I think it was yesterday or the day before. I know all the days this week, especially, have really been running together. But we were flying over some of the hospitals just to see what they were dealing with out there. Christopher writes, I was just admitted to the ER at that hospital, and I couldn't be seen in a room. I had to sit in a chair behind a curtain because the ER rooms are full of COVID patients who were admitted. So that just speaks to the stress of these hospital systems and our healthcare workers who are having to try to care for all these individuals. It's a massive strain. We heard from some nurses last night who are just saying, there is no room for us to even take a breath here in all of this. Okay, Garrett, we did get some information out from the White House, and I want to get to that because I know that's some information that's more difficult to find out there. So I want to make sure that we provide that for everybody who's watching with us this afternoon, and briefly touch on what we started with here, and that is the White House being concerned over this massive spread that we're seeing across the U.S. and considering whether the possibility is there that we could have our own mutation here in the U.S. that is spreading 50% faster than the virus that we've seen throughout these past months of the pandemic. Now, like we've seen other places, they'd be hopeful that the vaccine would respond the same, that it would not be as deadly, or it wouldn't be worse, I should say, than what we've seen in the past months of the pandemic. But is this a variant, or is this people not following all of the things that we've been taught to follow throughout this pandemic to keep ourselves safe, and that this is just an increase post-holiday, or if this is truly a variant that's out there? So it's just the start of looking at that possibility.
So as far as the variant is concerned, yeah, they're looking at that right now. In a conversation we had with ASU Biodesign a couple days ago, they are sequencing everything that comes in. They're sequencing, and they did say that they are seeing a different protein signature in a portion of the test. It is not, in fact, they made it specifically clear that it was not the majority of tests that were coming in, but they are seeing a different signature. Some of the proteins are at the levels where you would expect it for the UK variant. So that's what we were discussing then, to see if the UK variant was here. But as we talk about that, now they're talking about a US variant. I can see ASU Biodesign is now also probably going to sequence to see if what they were detecting was actually a US variant rather than the UK variant.
Yeah.
So that's going on right now. As far as the report itself, this is obtained by ABC News, and it's dated January 3rd. And the reason that's important is just with this first summary data, it's saying that we have the second highest rate in the country. That is no longer the case. On January 3rd, that was the case. It's no longer the case. We are the first highest in the country. And it's just showing, let's just go down really quickly to see what all of these are saying. As far as these recommendations, they are recommending here. This is where they talk about the variant, where they're trying to figure out if the variant is here or not, and what could be what's causing the increases. If we keep going down, we see what they're talking about in aggressively immunizing people as soon as possible. But we'll go through some of these tables here really quick to see where we are. You can see the White House says our positivity rate is about 22%. Here's our COVID deaths for the week was 605. That is a 3% increase of what we were doing. You can see our total viral tests are going down. We're actually testing less right now as things are going on. And then our test positive rate has gone up by 5 points. As we continue, you can see our hospital admissions 3% have gone up. Number of hospitals with supply shortages is about the same. It's about it's a little less than it was. And the number of hospitals with staff shortages is about 6% less than it was at 35. And then we'll continue down here really quick. We go over a lot of these numbers a lot, so I don't want to spend too much time on these numbers because you see them all the time if you watch us. But we will go through and look at the counties here on what they have. There are no counties in Arizona or metro areas that are considered in the orange or the yellow zone. In fact, all of them are, as you see, every single one of them is in the red zone.
And when we look at this, Garrett, it's just wild to see. So all 15 counties are ending up in the red zone. We've got 11 metro areas, and I see Brant in the comments asking about Prescott Valley. Look right there, Brant, in the red zone, in the red zone. So at this point, this is not an issue to be ignored in any of our major metro areas, or 15 counties. We might be seeing a slight decline county to county in some of the more rural counties that we were looking at before, but we are still well in the red zone everywhere.
All of the declines we're seeing are very slight, and they're nowhere near getting them back into the yellow.
Right.
Yeah, and we can see this right here. We see Maricopa, Pima County. You can see Pima County has a bit more of a decline than Maricopa does. Maricopa and Pinal are mirroring each other, as you would expect, because they're part of the same metro. Yuma County is going down right now. Mojave County is going up right now. Yavapai County is sort of going down a little bit. Cochise, Coconino, all of these are going down a little bit, but again, this is a little bit right now. There's a lot they have to go down a lot more before they can go to yellow. And then here we go. And again, this is January 3rd to make a point. So they were going down, but some of those counties have gone up since then. Just to make a point there. You can see as far as the new cases per 100,000, it's really the western edge that the White House is talking about as being having the highest rates. The positivity rate is all over the place high, mostly Maricopa, Yavapai, and then the southern edge of the state. And then we look at the new cases. There's very little change in any of these. So again, we're just going through this and showing you where things are. Very high death rates right now in the Navajo Nation, and we would expect that because they are always leading what is happening in Arizona. So they're going through their highest death rates right now. The rest of Arizona is probably not going to go through their highest death rates for a couple weeks. Excuse me. So that's what the Arizona report looks like right now. As you can see, as far as the White House task force is concerned, it's everything
very concerning.
Red, dark red. Yes.
Yeah. And for good reason too. I saw in your notes to me this morning, Garrett, that every single metric that we track, every major metric that we track is now in the top 10 if you're ranking our dates against themselves. Mm-hmm. Throughout this pandemic.
Yes.
So there's not one like leading metric that's showing us a way out of this. We're really in the thick of this winter surge.
Right. I mean, that's why, when I started out, when we started out here today, I said, every day is the worst day in Arizona right now. And that's at least going to be the case for a couple more days. I don't know what's going to happen next week. Really, as far as reporting is concerned, things really reset day to day. It used to be on Tuesdays. It looks like it's happening on Mondays now. They're pushing a lot more cases out on Mondays than they used to. So we could be seeing. Oh, go ahead, please.
Well, I was just going to say, if and not to interrupt, but if anything, what we'll see next week is maybe some stabilizing of the numbers because we're getting farther away from the holidays. Because it seems like it, for these past couple of weeks in every anomaly that's reported. It's followed up with the but it's got this holiday was in there or this was in there. It's just maybe some stabilizing of the numbers because what we've had to do to sort of even out those numbers is look at week to week to week to try to understand what's happening here, and at least maybe our day-to-day numbers will provide a little more real-time look.
Yeah. And here's a good example. Well, in fact, you actually brought it up exactly. I was pulling up. So I've got the azdhs website up. Mm-hmm. And I've got it to week by week as we talked about, and this is the Thanksgiving surge right here, and you can see the difference between November 22nd and cases that were added on Thanksgiving and after Thanksgiving. But you can see as we got farther away from Thanksgiving, the surges, the increases were there, but the increases were at a much lower rate. They only increased by a little bit, mm-hmm. And then this is a reporting issue, which is unfortunate. But when we look at those three, let's just focus on these 3 weeks. The good thing, at least the positive aspect of this, is that if we're in the midst of this, for example, if this is this, then this next week is going to be it's going to be somewhere in the over 50, should be in the 60s, and then we might have another week that's really bad that gets us into the 60s and 70,000s for a week, and then there's a potential after that we start to see decreases. So hopefully in the next 2 to 3 weeks of reporting, we're going to start being able to say, hey, we're at least starting to turn the corner.
Yeah.
That might happen as we exit the holidays we unfortunately we're still looking at about 14 days or so of reporting sort of bad numbers, but we could be getting to the point where we're starting to report better numbers here sooner than later.
Hopefully, hopefully, hopefully. Yeah. Okay. So a few of the other things we're gonna run out of time, and I know everybody wants to get an update on some of the numbers of the active cases here in Arizona, and I see some new names in the comments, so I want to make sure everybody understands how we sort of arrive at this number, and that is taking the total number of cases here in Arizona, which is almost 600,000. I mean, we could hit 600,000 tomorrow, couldn't we, Garrett? I mean, very easily if we.
Yes. Well, we will almost certainly hit 10,000 deaths tomorrow. That's
Yeah, I'm seeing that too.
And we should also hit 600,000 cases. That's both of those metrics should be passed tomorrow.
Yeah. So some
the total number of cases.
Some landmark numbers to pass in the next 24 hours or so here. So just to help everybody understand, obviously we don't have 600,000 active COVID-19 cases here in Arizona. The life of the pandemic, people have recovered, although we do have long haulers, people who are, that's the term for people who are fighting this for a very long time as they try to work to get better, or at least to get closer to who they were before they were infected with this. So we take 600,000 and we subtract away, sadly, the nearly 10,000 people that we've lost here in Arizona, and then subtract out any of those that would have likely timed out, who would have likely gotten better, but there's just no definition for an absolute recovery from
COVID. The best definition we would use is just they are no longer infectious.
Right.
We don't know what their long-term effects of COVID are, so we can't call it a recovery. But what we can say is, with a very high degree of certainty, that over a period of time, if the case is over 27 days old, for example, and the person did not pass away from the case, then by all accounts that we have so far in all of this data, they're no longer infectious. So what we have in Arizona is we have about 90,000 cases in Arizona right now that are currently infected that are less than 14 days old. So these are people who really, I mean, this is the core of the infectious confirmed cases in Arizona, these 90,000 cases. We have 180,000 cases that are under 28 days old. So these are, there's a possibility that a portion of those are also going to be infectious. So the infectious number is going to range from about 90,000 to probably 120,000 in Arizona. But after that, we have about 500,000 to 410,000 that are they are inactive cases. They have COVID. We don't know what the recovery is like, but we know that they are no longer infectious.
Yeah. Okay. So that helps us better understand that range. I also sort of update people on the fastest growing states that we've seen overnight. And we know that it has been tragic, obviously, for the United States. We had more than 4,000 deaths related to COVID reported in the last 24 hours. So that is, to put that in perspective, in the history of the United States, I mean, this is more than 9/11. This is more than Pearl Harbor. These are huge numbers that are being reported in every day. As far as cases go, the fastest rising cases, that's happening in California, Texas, Florida, New York, and the new one on this list today, North Carolina. So those are the fastest growing cases. So as we lead in,
as a point too, there's actually another interesting thing. That UK variant is hitting Ireland very, very hard.
I saw that.
Let me see if I'll add Arizona to this so you can see it. But this is the map that we use to track where we are. This is where you can see that Arizona's been the top for about 4 days. This is where we've been leading. But you can see Ireland started at one of the lowest infection rates 6 days ago in the entire world at 27.4, and they've shot up in 4 days to 104. That line is just incredible.
Yeah, it sure is.
That is the textbook definition of an exponential growth that we're seeing right there. So I don't know what's going on in Ireland, but whatever that UK variant is doing, it's doing some real damage in Ireland right now.
So here's my question to everybody in the comments right now. 2 questions, actually. I am really interested in what Kirby just wrote one comment ago. Kirby writes, with these numbers, why is the traffic still crazy? I'm curious what you all think in the comments. Do you think people are getting more comfortable? Do you think that you know, they've gone 10 months now, maybe wearing a mask and thinking like this is enough. Are they letting their guard down? If you were one of these charts that you're seeing on here with Garrett in your own activity, like let's say you were just learning more about COVID, then you started to take it very, very seriously, then maybe your house loosened up, your kids went back to school, whatever those things are, how would your own graph look in this? And does the variant that you're hearing about now concern you more? Does it have you pulling back a little bit more, or changing your personal habits in any way? So just curious how that the two-part question, how that has you all changing your sort of situation at home. Because Garrett, when you hear it could spread 50% easier and you see those changes in Ireland, that's concerning.
Well, and again, this what I'm going to say right here is above my pay grade, but you know that Ireland obviously has very, very strict mitigation measures, and this is a massive breakout. They've kept themselves very, very low during the course of this entire pandemic, and now their numbers are just going through the roof. So you know, this is a situation where it's like, well, are they? I don't believe they loosened up on their mitigation efforts. I mean, obviously there was still some Christmas and New Year's, all of that stuff that happened, but that's a pretty incredible line to just be Christmas and New Year's.
Yeah.
And so there could be, as you said, that because this variant is so much more infectious, that it's, you know, what does that happen? What happens to us in the United States, which typically don't have as strict measures as Europe? What happens when it touches here? You know, I mean, that's just a question of you know, it's rhetorical, but what could happen? You know?
Yeah, exactly. Okay, we are already getting close to running out of time. I know we didn't get a ton of time for the comments and questions in there, just because we had so much to cover, and we apologize for missing the past few days with you all. Obviously, the breaking news across the country was absolutely more pressing at that very moment, but we still want to make sure we took time here with you today to keep you updated on everything. So people are asking about Doug Ducey. The next time we are set to hear from him is his State of the State, which is coming up on Monday, I believe. And that's the next point. I don't expect that there will be a session for questions. I could be wrong. They could, yeah. There never has been, but
and they're just talking State of the State. There's never been a question and answer State of the State, so I don't presume it's going to be.
Yeah, but that is the next point that we expect to see him or hear from him in public. So just to keep you updated on that part of everything. And Garrett, what will you be watching over the weekend in all of this, or what is of your closest concern right now?
Well, I think right now, of course, we talk about the CLI numbers are always updated on weekends, on Sundays. So to see where the CLI is going is always very important. One of our first and leading indicators is going to be what happens at the CLI. The others, of course, is vaccine distribution. As counties move into the 1B, you know, is that going to impact the speed in which the vaccine is being administered? So I think really I'm going to be focusing on those two items right now.
Yeah. So once again, if you guys want any more information on the vaccine changes that are happening here in Arizona, as far as signing up, if you believe that your workplace is in Group 1B, you can find all of that over on the Arizona Department of Health website, which also has the summary page there that we get some of our numbers from. So there's a whole lot of information. And then if you have questions about what group you actually fall into, or where your county specifically is, either in 1A or 1B at this point, you can find that on there. So a little more information if you want to dive into it. Also, you can find Garrett's updates in the mornings, usually after a quick cup of coffee, right at Garrett_Archer. You can find his updates there that give sort of a brief overview of how things look. I'm on Twitter at Katie Rammel. Also, since many of you are watching and commenting here on Facebook, you can find me on Facebook at facebook.com/news from Katie. In the meantime, our very latest reporting is coming up minutes away at 4. We're on a little late today. Minutes away at 4, 5, 6, 6:30, 9, and 10 p.m. You can find all of that also on abc15.com/coronavirus. If there's anything you missed or want to share with others, you can find that there. Our schools updates are on that page as well. So a lot of information for you to find there. Judy's Redding, thanks again for the great information. Judy, you're so welcome. Thanks for joining us on here. Donald Redding, thank you. Thanks to all of you for taking time in your day with us as well. So be safe out there, everybody.